Hello, my name is Charlotte and I'm here today talking to Harry. Harry, thank you for joining me.
No problem.
Lovely just to hear a bit more about yourself. So tell us who you are. It sounds like Cilla Black here. Who you are and what it is you do, please.
So I'm a research practitioner here at the Christie. That's sort of a split role between clinical trial admin, so contact with sponsors and the people funding the trial, but it's also the other 50% is very patient focused, very patient centered and patient facing in fact.
So it's a fairly new role, you say. How important is this role? Because it feels like it's doing a lot of work bridging a gap.
It bridges the gap between sort of the admin and the patient. So there's a big project I'm heavily involved in at the moment, which is involved in sort of, it's supposed to be a new paradigm in clinical research. It's supposed to be a new kind of clinical study. It'll bring something new to patients. It will hopefully ease the burden on the NHS, and it will hopefully see if we can make research easier for patients, easier for staff, and hopefully still get really robust results that will help patients and the industry and healthcare move forward. You
mentioned as well that you're not clinical, as in you haven't got that medical side of things. What is your background?
So I just started volunteering in hospitals initially I was doing patient surveys. So I was going around the ward and I was with an iPad talking to patients, asking them what their experiences had been while they were in hospital. And for a 16-year-old who didn't know much about healthcare, that was great because it was a good introduction. So that was while I was doing my A-levels. Then I went to university. I did biochemistry, which later developed into a biochemistry and genetics degree. I always loved science and learning about how things worked, so it was kind of a good fit. So I then did a master's in translational oncology, which is essentially cancer research, learning about sort of how cancer works, how it starts, how to treat it, and then it was I did my own research project in the other half of that master's degree as well. So, and then during then COVID happened, and then I took up work as a healthcare assistant as well. So, and I did that while I was finishing off my master's degree, and then afterwards as well. I've done quite a few things, but I always knew I wanted to work with patients. And I was fascinated by sort of clinical research and the role that research plays in like our healthcare system. So this role was perfect for me because I could do both. I could work with patients and I could be sort of in the nitty gritty, so to speak, of research, and so that's where I am now, I guess.
You say you've always wanted to work with patients. Why have you always wanted to work with patients?
To be honest, I've just always really enjoyed it. I enjoy those conversations with patients. I enjoy sort of making that connection with them. Through my personal life as well, I can appreciate how much of that is really beneficial. I think we all of us play such a huge role in making patients feel comfortable and helping them understand what their journey is and where they need to go in the future to get better and to sort of empower them to improve their own health and so I've always just really enjoyed those conversations. I've just enjoyed sitting down with them, and I've enjoyed connecting with them, and I've enjoyed sort of helping them along their journey.
I appreciate there's very rarely a normal day in anyone's life or anyone's work.
Yeah.
But what does a normal day look like for you when you're coming into work?
So at the moment, my project's just getting started. So there's a lot of meetings around sort of processes, how this trial's so new. There's a lot that we haven't encountered before as a team. So there's a lot of meetings going on. There will be lots more direct patient-facing stuff. So as these patients become enrolled into this study, there'll be a lot of contacting patients through the telephone. There'll be a lot of meeting patients in person, possibly, to discuss certain things, to give them an information sheet, to tell them all about our study, which is really enjoyable. Do some clinical skills, so taking of bloods, taking of ECGs, and things like that, and sort of delivering samples to where they need to be at the right times. So I do help out with some of that in our team as well. So it brings quite a lot of variety to the role. So lots of problem solving, lots of practical stuff, lots of meetings, but that's fine.
And tell us a bit more about the project then that you're working on. What you're looking at, what you're hoping to achieve from it at the moment.
A typical clinical trial will involve a patient will be given an information sheet. They will be given 48 hours to consider that what the clinical trial might involve. They will be given time to discuss it with their families, and then they'll be enrolled. They will have a lot of screening visits. They will be there's a lot of tests to make sure that it's safe to go on the trial, and that that they are the suitable patient to collect all the information that we need. And it's a lot of visits on the patient side. They will go through many extra visits to the clinic for extra blood tests, for extra ECGs, for extra discussions with their consultant. This project that I'm working on is we're hoping to introduce something new. So we're hoping to change that a little bit. So the question is, with this project, can we get the same amount of information about whether a treatment is better than what we've got now, or maybe not as good as what we've got now? Can we get that same information just by using the data that a patient might get anyway, without being on a clinical trial, if that makes sense? I know that's so it's asking that question of can we bring less burden to the NHS and still get the same information? Can we bring a patient into the clinic fewer times? Can we not have to subject them to extra blood tests? A lot of people hate needles.
Yeah.
But that's completely new in research. No one really knows yet whether we can just analyse the data that we might already have in healthcare.
I think there's a lot of myths and concerns and worries around the words clinical trial, especially if you're a patient or a patient's family member as well.
Yep.
If there was one myth you could bust right here, right now, what would the myth that you want to bust be?
It's not about trying to trick patients into taking one certain kind of medication because that makes certain people richer. And it is really about the patient. All of this that we do is purely to help develop healthcare further, to bring less burden to patients, to make cancer treatments as a whole more effective. And I think that's a responsibility that we have as a society. So that's really what it's all about. It's all about the patient. The patient's at the centre of it all.
Harry, your passion for this is just oozing everywhere, and I love it. It's really clear to see, and it's fabulous to hear it as well. So thank you very much for talking to me today.
No problem at all. Thank you.
I've really enjoyed it. Thank you.
Thank you.